Hi, I'm Senn, your state representative from the 41st Legislative District. When children can't stay with their families for safety and wellness reasons, it's often the job of the state to step in. But it isn't enough to just remove children from dangerous situations. We need to fully support them. Children in foster care frequently have above average numbers of adverse childhood experiences, or ACEs, including abuse or neglect that lead to them being removed from their families. ACEs have a lifelong impact on health and well-being. Stable, nurturing relationships can help mitigate the impact of ACEs, which is why it is so important for kids in foster care to stay close to family members, teachers, or other adults who care for them, and at the same time, get them the services they need. But Washington's foster care system has been struggling. It's being squeezed on both sides. There are less foster families available, and there are more children in need of placement. It's especially urgent for us to address the needs of hard-to-place children, typically those with serious behavioral and mental health issues. Sadly, these children are staying in hotel rooms or being sent out of state because there aren't places in our state for them to stay. The good news is that in recent years, there has been movement to try and address the problem, including the creation of the Department of Children, Youth, and Families, and the adoption of the Federal Families First Prevention Services Act, which will help us shift focus toward prevention. But the legislature still needs to make significant investment in foster care's behavioral rehabilitation services and group home settings for hard-to-place kids. The House budget will ensure that there are enough therapeutic placement options to bring home our out-of-state kids and meet the growing needs of the foster care system. We need to fund mental health and substance use disorder treatment, and we need to ensure that every foster kid has stability and support. These are our kids. We have to treat them like family and help them here, not send them away to other states. As chair of the Human Services and Early Learning Committee, I will continue to lead on this issue and others that look out for our state's most vulnerable.